Thank you very much. And thank you, dear Iratxe ministers, honorable members and representatives of the health sector. So good afternoon to all of you. We all know that in tough times like these, we're all in crisis management mode. But the greatest mistake we could make is to only focus on today's difficulties. They are important, but then to lose sight of the future. So thank you very much for today's event. This is, as you said, Iratxe, not just about solutions to the current crisis, but it is about a vision for Europe. So let me begin with the words of a father of European integration, Jacques Delors. When Delors took office, Europe was in the middle of a crisis, although of very different nature. They called it euro-stagnation. So Europe's incapacity to move forward. But something was changing, and there was new energy in the European institutions, and Delors knew it. And in his first speech to the European Parliament as president of the European Commission, that's how he described his own task. He said, "We are in a situation where the community can seize the favorable winds or else once again miss its chance," end of quote. So today the winds are stormy, but just like then, there is a chance that Europe cannot miss. A demand for European action from the European people. 2 out of 3 Europeans tell us that from their point of view, the European Union should have the ability to deal with a health emergency. And this is also what I believe. The European Health Union is the next step on the path towards a better union. I see at least 2 reasons for this. One is to improve how we prepare and respond to crises. This is the first pandemic that we experience in Europe. It takes such a heavy toll on us. And we might face similar outbreaks in the future because of the loss of biodiversity. Other zoonotic diseases might hit us. The health of our planet and the health of human beings are linked. We know it by now. So we call it a One Health approach. And in the event of another pandemic like this, we must be sure that all European countries are equally prepared and responsive. This is the most immediate reason for advancing towards a health union. Health is a national competence with national and regional authorities in the lead. But there's a lot more we can do at EU level by using the full potential of our treaties. So greater cooperation is already possible, and it can save countless lives. And this is the logic behind the Health Union package that we presented in November. There are 3 sets of initiatives in the package that I would like to mention today. First, to be better prepared and responsive. Second, on the role of European agency. And third, setting up a real European health union beyond emergencies. So first on cooperation. At the beginning of the pandemic, we saw that lack of coordination brings a high cost for member states and for citizens. But after the initial shock, European coordination kicked in. We have, for example, established the green lanes to ensure the seamless flow of goods in the single market. We have saved money through the joint procurement of medical equipment and used our market force. We have addressed the shortages of ventilators and protective masks. And we have given clear guidelines to people traveling across national borders. We are now turning the ad hoc solutions into structural measures. So we propose to transform the decision on cross-border health threats into a regulation. And this will make cooperation on health emergency a legal obligation, not just a makeshift measure. We want to have an EU-wide preparedness and response plan. This European plan will rely on coordinated national preparedness plans, which will be audited. They will be stress tested with the support by the European Commission. And The regulation will also enable the Commission to declare a state of EU health emergency. This would, of course, be based on the advice of an independent advisory committee and always be in coordination with the World Health Organization. Declaring a EU health emergency would trigger greater coordination among member states, so joint procurement of medical equipment, and it would trigger the deployment of EU outbreak assistance teams. In other words, next time, Europe should be ready and fully equipped right from the start. Our second set of proposals concerns European agencies. The ECDC and the EMA, European Medicines Agency, they have been doing an extraordinary good and essential job since the beginning of the pandemic. But we must all say their current setting has serious limitations. So we propose to give them more responsibilities, more powers, and more resources so that they can better support the member states. We want to strengthen the ECDC with greater capacity to analyze big data and to use artificial intelligence. This is of utmost importance. So the ECDC can become our kind of state-of-the-art public health surveillance system. And based on this, the ECDC should provide very practical recommendations to member states. And in an event of an outbreak, it should dispatch a health task force to member states in need. As for the European Medicines Agency, we wanted to monitor and to address the shortages of medicines and medical devices. We've seen in the crisis that this can happen. And on top of this, we also want to create a new European Health Emergency Preparedness and Response Authority, long name, so HERA for short. Hera, just like the queen of Greek gods. Hera will focus on foreseeing the next crisis and, if possible, averting them. So Hera should be able to tell us this is the next threat that we might face in a number of months or a number of years. And we want to be one step ahead of the curve. Hera will be our main tool of foresight and for planning. And HERA will then follow the whole process, leading from conception to deployment of the new therapies, vaccines, or technologies that are being needed. And on top, HERA will work with all relevant players. So we're talking from innovative startups to, for example, civil societies and NGOs, but also various organizations or the big multinationals. This time we want to make sure that Europe can quickly develop and deploy the solutions to the next health crisis. Now, when I'm explaining this, think about the work we are doing to secure doses of a future vaccine for Europeans. This is a blueprint. What have we done? We have negotiated and concluded 6 contracts with pharmaceutical companies so far. We have learned that we are much more effective when we go to the markets to negotiate together. We have market power and the leverage of 450 million Europeans. So in a result, today, the European Union has one of the most comprehensive vaccine portfolios in the world. And this is something we should keep in mind, even beyond these times of crisis. So in sum, these 3 agencies will provide member states with all the guidance, the expertise, and the solutions they need in an emergency. Our third and final set of initiatives looks beyond crisis management. So the European Health Union shouldn't just be about emergency. There is a clear European added value in cooperation on health issues. Economies of scale, or common standards, or even greater equality across our continent. So the European Health Union can contribute enormously to improving national health policies. Together, for example, we have the strength to support the development of groundbreaking medicines that are as well as affordable, as widely available. Both factors are important. And this is the core of our pharma strategy, for example. New medicines and new therapies should be available to all Europeans in all European countries quickly. Of course, only when they have proved to be safe and effective, but then everybody should have access. And we are putting our union's critical mass, in this case, to the service of patients and member states. Many of our public health issues, we know it by now, need to be tackled on a continental scale. So take, for instance, the sharing of data among researchers. If you talk about access to high quality and standardized data coming from all corners of our continent, that can be an incredible asset in the hands of European researchers. This is one reason why we're creating a European health data space. When talking about data sets, we all know size does matter. So access to big data will also be a pillar of Europe's Beating Cancer Plan for better prevention, for better diagnosis, and of course, for more equality across our union. All of these initiatives will shape the European Health Union. And it is now up to us, Commission, Parliament, and national governments, if I may take the words of Delors, to seize the winds and take another step towards a better European Health Union. Thank you very much for sharing this time with me, and I wish you a very good webinar. Thanks a lot.